Hi, everybody. This is Janet with the Rock Island County Health Department. Thanks for joining us today. Today we have with us Nita Ludwig, the Administrator of the Rock Island County Health Department, Ed Rivers, the Director of the Scott County Health Department, and Mike Miller, the President and CEO of Riverbend Foodbank. We ask that you put your questions in the chat box, and after the speakers' prepared comments, we will take your questions. Thank you. Nita, you want to start us out with numbers?
Sure. Good afternoon. Unfortunately, today, Rock Island County Health Department is reporting 3 additional deaths from COVID-19 in our county. A man in his 70s and a man in his 60s, both of whom had been hospitalized, and also a woman in her 70s who had been living in a long-term care facility. The total number of deaths in Rock Island County from this virus is now at 71. We send our deepest sympathies to the family and friends of these people, and we really ask everyone to keep us all as safe as possible. Please continue to follow the public health precautions of wearing a mask, keeping your 6-foot distance between yourself and others, and washing your hands frequently. In addition, the health department is reporting 26 new COVID-19 cases, bringing the total in our county to 2,556. Currently, 14 patients are hospitalized in Rock Island County. 2 of these cases today are associated with the outbreak at the prison in East Moline, which means that 24 people living in our community became infected with COVID-19. So prison has reported dozens of cases in the last few days, we realize, but the total number associated with the prison is only about 10% of our total number of positive cases in Rock Island County. So overall, community spread is a much larger issue here in Rock Island County. Thank you.
The Iowa Department of Public Health has announced 2,390 cases for Scott County. And over the weekend, they reported 2 additional COVID-19 related deaths. Our deepest sympathies go out to the family and the friends of these residents of our community. The individuals we have lost to this virus have been our neighbors, our family members, co-workers, and friends. We ask that we work together as a community to slow the spread of this virus and protect each other. Labor Day marks another holiday period during the COVID-19 pandemic. As public health officials, it's our hope that residents heed our advice and honor the holiday in ways that didn't involve large numbers of people, didn't involve close contact, and that we all stayed indoors. We know that COVID-19 has put a damper on pretty much everything that's taken place in the last 6 months. School graduations, family vacations, summer events, sporting activities, school and private gatherings. Changing our daily behaviors has been a real struggle and will remain so. However, we know that for many in our community, the quick onset and prolonged duration of the pandemic have initiated even harder financial struggles. We know that many in our community have been affected by business closures, prolonged illnesses causing missed work days, and reduction in pay caused by changes in our spending habits as consumers. For some, this may have families reaching out for what may be the first time to resources such as a Riverbend Foodbank in order to make ends meet. Today, we're joined by Mike Miller, President and CEO of the Riverbend Foodbank. The Food Bank, a foundational partner in supporting families in our community since 1982, has also experienced unique challenges due to the COVID-19 pandemic. Thanks for joining us today, Mike.
All right, thanks, Ed. As most of you know, Riverbend Food Bank has been deeply involved in the COVID-19 response since the onset of the virus, experiencing what we've been referring to as a triple threat of factors that are affecting our work. First off is significantly increased demand, and we'll get into more of that in a moment. A seriously interrupted supply chain, which has caused the food bank to have to purchase considerably more food than usual, which has a significant impact on costs. and substantially inhibited operational methods with social distancing, no contact, food distribution, limited opportunity for volunteers, and such. But today we have more specific data as to the impact of COVID-19 on the need for hunger relief, and I wanted to share that with you today. Prior to COVID, the highest level of food insecurity in the country was during the Great Recession of 2009. And it has taken us a full 10 years to recover from that recession. Had COVID not happened, we were just ready to announce this year that we had finally gotten food insecurity reduced below the pre-recession levels of 2008, with 105,830 people who did not have enough food in the 23 counties served by Riverbend Foodbank. And then COVID happened, exploding that number up to almost 160,000 people, which is more than a 50% increase, and more than the peak of 141,000 people back in 2009. So I'm sad to report to you today that we are now at the highest level of food insecurity ever in our history. That said, Riverbend Foodbank's response and the community support has been unprecedented. After distributing an average of 1.6 million meals per month in calendar year 2019, the food bank set new monthly distribution records in April, May, June, and July, averaging over 2 million meals per month and a new record of 2.3 million meals in July. So we are almost keeping up with the increased need in spite of significant obstacles. Now, to put that in perspective, in Riverbend Foodbank's 38-year history, our first 1 million meal month was in August of 2016, and our first 2 million meal month was just this past June. So it took us 34 years to get to 1 million meals in a month and less than 4 years to get another million, which is a testament to the outpouring of community support toward this effort. August was not a new record, but it was our second highest month ever, except for July. And while we would like to believe that this represents a flattening in demand, we suspect that we lost about a week with the derecho storm, with tens of thousands of people unable to receive frozen and refrigerated food. I'll add a word about the derecho. My wife likes to call that the derecho, which I think is an appropriate name for the storm, making a wreck of things. The storm just added to the calamity that is 2020, adding to the number of people in need. And both food pantries and their guests were unable to receive or accept frozen or refrigerated food. But I'm happy to report that the food bank was out of power for a grand total of 20 seconds. A few years ago, we developed both a disaster plan and an emergency response plan for the food bank and invested in an 150 kilowatt natural gas generator with the community support. We lost power the day of the storm. The generator's on a 20-second delay so as not to respond to spikes or blips in power. And 20 seconds later, the generator kicked on and we ran on generator power for 2 days straight, saving over $250,000 worth of food in our coolers and freezers. So the generator more than paid for itself several times over, and we were able to continue service to people in need. So thank you to those who supported that project back in 2017. The last thing I'd like to call to your attention is that September is Hunger Action Month, and this coming Thursday is Hunger Action Day. This is an opportunity nationally to shine the light on the everyday disaster of hunger. Now, because of COVID, we are back to 1 in 7 people in our community without enough food, and it's now 1 in 4 children. 1 in 4 children sitting in school right now does not know where dinner's coming from. Meanwhile, this country throws away fully 1/3 of the food we produce, and that is enough food to feed everyone. We are just throwing it away. So the only thing it would take to end hunger in our community is for us all to commit to never throwing away food that could still be eaten by someone in need. So we are asking the public and the media to join us in this observance and use the occasion to help our community understand that hunger is a completely solvable problem. In closing, many thanks to the community for their generous support. We could not be doing what we're doing without them. And we're currently focused on balancing the need to respond to this spike in demand against the need to sustain this response over time. Because just like the Great Recession, this is going to be a marathon, not a sprint. As always, it takes three things to make this happen: food, time, and money. There are links for people to help with each of these on the Foodbank website, as well as resources for people who need food and might not know where to turn. So we invite anyone who wants to help or to learn more to visit our website, riverbendfoodbank.org. And with that, I will wish everyone a happy Hunger Action Month.
Thank you so much, Mike, for sharing that wealth of information. We do have a couple of questions that have popped up, so we'll go to those quickly. Do you know how the school's hunger drive will be done this year, and do you anticipate that it will still proceed?
Sure, thanks for the question. The food bank made the decision back in the spring to postpone the student hunger drive for 2020. We would have had to do some things back in May to get ready for a drive this fall, and there was no way to know whether we would be able to or not. And so we are currently, have our fingers crossed that we may be able to do something in the January, February timeframe. But that, of course, no one knows what's going to happen tomorrow, nonetheless, January or February. So at this point, I know there are some schools that are still doing some things. We've heard from some schools that still want to collect some food to help hungry people. But the formal student hunger drive won't be happening this fall, and we're hoping that we can happen early in the next calendar year.
Also, does the food bank need more and regular donations to hire more workers?
So that's a great question too. The community has been amazing in its support. The problem is the need to, as I referred to balance the immediate response against the need to sustain this over time. We have been able to do, our costs have skyrocketed because with stores out of things, then there's nothing left to donate, or there's less to donate to the food bank. So we've had to do more purchasing so a higher fraction of what we're distributing is now purchased food, which has increased costs. Fortunately, the community has helped make that happen. But as I shared, this is going to be a long-term situation. And so that we're hopeful that level of support continues from the community, whether that's with purchased food, or staff, more drivers because we're doing more distributions, and then we're starting to ease back into having volunteers as well, which also will help with get some of the tasks accomplished. In terms of this, I see one other question there, Brooke. How can people help with the supply chain problem? It's purely finance. We have had to turn. We're purchasing about 50% more food than we normally do because of the fewer donations that are in the supply chain. And then that's been wrought with issue as well, because, you saw at the stores we're out of things. Well, that didn't leave anything to buy, or lead times that normally measured in weeks are measured in months. But we've done a good job of staying ahead of that. The concern early on was, oh no, with this increased need, might we run out of food? And I'm happy to report that no, we're maintaining inventory levels even above what we did a year ago, because we got ahead of the game and placed purchased food orders early on to make sure that didn't happen. So I think we're okay, but that of course is dependent upon continued response. But financial support is still the most important way people can help.
Thank you. We'll give it just another second, see if there's any additional questions before we end the briefing today. If people want to volunteer, what should they do, Mike?
riverbendfoodbank.org. It's right across the top. So it's just like give food, give time, give money. Click on give time, and they can just register themselves as a volunteer, and any volunteer opportunity is listed there. People can just schedule themselves.
Well, that's a perfect way to end this. One last question. This one is for Nita. For Nita, could you tell us what the Rock Island County Health Department is doing with the Department of Corrections to help with the outbreak?
Okay, I think I'm unmuted. Can you hear me?
Yes, we can.
Okay, so the Department of Corrections really is handling the outbreak of the inmates. However, the staff and other people working in the correctional facility obviously come and go, and they are members of our community. So if and when there are positive cases among the workers, we would follow them at the health department here, and we would do the contact tracing of those individuals and follow up with any close contacts in that.
Okay, so thank you very much, Ed, Nita, and as well Mike for joining us today. We greatly appreciate your support with us getting information out on these press briefings. Thank you to our media partners. We will be posting a recording of this onto our website as well as our social media pages. So if you've missed any of the details, you can check there. And we do look forward to speaking with you later this week as well. Have a good afternoon, everyone.
Thank you.